Welcome to the deep dive. Today we're going to be tackling a topic that's pretty vital, heart attacks.
Yeah, those are definitely important.
Yeah, we're looking at the Wikipedia article on myocardial infarction.
Uh-huh.
And I gotta say, even reading the title kind of gets my heart racing a little bit.
Well, hopefully not literally.
Yeah, no, hopefully not literally.
But you're right, they're a big deal.
Yeah.
Heart attacks, or MIs, are one of the leading causes of death worldwide.
Wow.
And they have huge impact
Really big impact.
beyond just like the health of the individual.
Yeah,
Yeah.
absolutely. So before we get into the really complicated stuff, can you give us like the simple explanation of what an MI actually is?
Yeah. So imagine your heart is like a house,
Okay.
and all the coronary arteries are like pipes that bring in fresh water,
All right.
or in this case, oxygenated blood.
Okay.
A heart attack happens when one of those pipes gets clogged.
Uh-huh.
And so the water can't get to one part of the house.
Right.
And if that part of the house doesn't get water, it,
It dies.
yeah. Oh, that's basically it.
That's a good analogy. That makes sense.
Yeah.
But it's easy to get confused with other heart conditions.
Mm-hmm.
So like how is an MI different from, say, a cardiac arrest?
So think of it this way. An MI is like that blocked pipe.
Okay.
It's like a localized problem.
Mm-hmm.
Cardiac arrest is more like the whole power grid going down.
Okay.
Everything stops working, not just one part of the house.
Oh, okay.
So a blocked pipe could eventually lead to the power going out,
Right.
but they're distinct events.
Got it. So different levels of emergency there.
Yeah.
Now, the article mentions acute coronary syndrome,
Mm-hmm.
which sounds pretty serious.
Yeah.
Where does that fit in?
So acute coronary syndrome, or ACS, is like the umbrella term.
Okay.
It's like saying plumbing problems.
Right.
You know, there's different types of plumbing problems.
Yeah.
Like a leaky faucet's one thing, a burst pipe's another.
Yeah.
So unstable angina, where you have like chest pain, but there's no actual heart muscle damage.
Uh-huh.
That's like a leaky faucet. You know, it's serious.
Okay.
But not an immediate catastrophe.
Gotcha.
An MI, where there is damage to the heart muscle, that's like a burst pipe.
Yeah.
You need to fix that right away.
Okay.
So ACS is the general category. MI is the,
Mhm.
we've got a serious problem situation.
Okay. And then even within MI, there are different types, right?
Right.
The article mentions STEMI and STEMI.
Yeah, so STEMI and STEMI, those refer to patterns that we see on an electrocardiogram,
Okay.
which is basically a reading of the heart's electrical activity.
Uh-huh.
Like your heart has its own electrical wiring system.
Right.
A STEMI means there's a complete break in a major wire.
Oh.
So there's a total blockage in a major artery.
Oh.
And STEMI is more like a frayed wire or
Okay.
blockage in a smaller artery.
Right.
It's still bad.
Yeah.
It's disruptive, but maybe not as immediately catastrophic.
Got it. So STEMI is the call 911 immediately,
Yeah,
and STEMI might have a little bit more time.
right.
Makes sense. But what about the symptoms? I feel like we've all seen those movie scenes where someone clutches their chest dramatically.
Right.
Is it always that obvious?
You would think so,
Hmm.
but actually about 30% of people, especially women,
Wow.
have what we call atypical symptoms.
Okay.
So instead of that classic like crushing chest pain, they might just feel nauseous or tired,
Mm-hmm.
maybe have some back pain,
Wow.
or even just a general feeling that something's not right.
Okay, so it's not always super obvious.
No, it's not.
So basically, any unusual discomfort, especially in the chest, neck, or jaw,
Yeah,
should be taken seriously.
absolutely.
Right.
And the sooner you get help, the better.
Yeah,
The better chance you have of minimizing the damage to the heart muscle.
that makes sense. So speaking of damage,
Mm-hmm.
the article talks a lot about atherosclerosis,
Yeah.
which is that buildup of plaque in the arteries.
Right.
It says that's like the main culprit behind most heart attacks.
It is.
Can you break that down for us?
Yeah, so think about your arteries like pipes again. Over time, cholesterol, fat, and other substances can build up inside those pipes,
Okay.
and that forms what we call plaque.
Mm-hmm.
Think of it like rust or mineral deposits in the pipe.
Okay.
Now, some plaque is stable,
Okay.
like a smooth layer of rust, you know,
Uh,
not ideal,
right.
but it's not causing a major blockage.
But then there's the unstable plaque.
Right.
What makes that so dangerous?
Unstable plaque is more like a jagged, uneven deposit that's prone to breaking off.
Oh, okay.
And when a piece breaks off, your body sees that as an injury and tries to fix it by forming a blood clot.
Oh, so it's trying to help,
Yeah.
but it backfires.
Right, that clot can actually block the whole artery then,
Oh, no.
cutting off blood flow to the heart muscle, and that's when you have a heart attack.
So it's not just the amount of plaque, it's also the type of plaque
Right.
that matters.
Exactly.
And it seems like a lot of things can contribute to this buildup.
Yeah.
The article lists age, smoking, high blood pressure, diabetes, cholesterol levels.
Uh-huh.
It's a long list.
It is a pretty long list.
Kind of scary.
But it's both good news and bad news.
How's that?
Bad news is a lot of potential risk factors.
Mm-hmm.
Good news is a lot of them you can control.
Oh, okay. So while we can't stop time,
Right.
we can make choices to reduce our risk.
Yeah, exactly.
Okay.
Quitting smoking,
Uh-huh.
managing your weight,
Yep.
eating healthy,
Yep.
keeping your blood pressure and cholesterol under control.
All good things.
Yeah, those are all things you can do to protect your heart.
Good advice.
And it's never too early or too late to start.
You're right. You're right. Okay, so we've got a good idea of what a heart attack is.
Yeah.
The different types, the risk factors.
Mm-hmm.
But let's move on a little bit.
Sure.
How do doctors actually diagnose an MI?
Yeah, so usually the first clue is going to be the symptoms you describe.
Okay.
But to confirm the diagnosis, they use a bunch of tools,
Okay.
including things like an ECG and blood tests.
Mm-hmm.
The ECG shows the electrical activity of your heart, and it can actually reveal patterns that suggest a heart attack is happening.
Oh, wow.
And then blood tests can detect certain proteins
Okay.
that are released when the heart muscle is damaged.
Oh, so it's like they're putting together the pieces of a puzzle
Yeah, exactly.
using all the different information.
Yeah, you got it.
And once they've confirmed it's a heart attack,
Mm-hmm.
what happens next?
Yeah.
What are the treatment options?
So that's where things get really interesting.
Okay.
We'll dive into all that
Okay.
in the next part of our deep dive.
Okay.
But before we move on,
Yeah.
is there anything from this first part that stood out to you?
Yeah. You know what really stood out to me was how many people have those atypical symptoms.
Yeah.
It's a good reminder that heart attacks don't always look like they do in the movies.
Uh-huh.
We need to pay attention to those more subtle signs
Yeah.
and never hesitate to get help if something feels off.
Definitely early recognition and treatment are key
Yeah,
for the best outcome.
absolutely. All right, so stay tuned, everyone.
Mm-hmm.
We'll be back in a moment to explore the fascinating world of heart attack treatment.
Sounds good. Welcome back. So before the break, we were talking about how doctors diagnose a heart attack.
Right, right.
But now let's get to the part I think everyone's really curious about. Treatment.
Yeah, what happens once you're actually in the hospital with a confirmed MI?
Yeah, so you might be surprised to learn that it's not as dramatic as Hollywood makes it seem.
Oh, really?
Yeah,
Yeah.
but it's just as urgent.
Oh, okay.
The main goal of treatment is to restore blood flow to that part of a heart that's been cut off.
Okay.
And there's a couple of ways to do that.
Okay.
For STEMI, the most effective treatment is something called PCI.
PCI, that sounds kind of familiar.
Yeah?
Is that the same as angioplasty and stenting?
It is, exactly.
Oh, okay.
It's basically a minimally invasive procedure
Okay.
where they thread a thin tube called a catheter
Mm-hmm.
up through a blood vessel in your groin or arm
Okay.
all the way to your heart.
Uh,
And then they inflate a tiny balloon at the tip of the catheter
okay.
to open up that blocked artery.
So it's like a tiny little plumber
Yeah,
going in there
exactly.
to fix the clog.
That's a good way to think about it.
That's pretty amazing.
Yeah, and they often leave a little metal scaffold called a stent
Oh, wow.
in place to keep the artery open.
Oh, that's cool. Okay, so what about NSTEMI? Is the treatment the same?
It depends.
Okay.
For high-risk and STEMI patients, PCI is also the preferred option.
Okay.
But sometimes doctors might go with a more conservative approach initially,
Okay.
using medication to stabilize things before they decide if they need to do TCI.
So they kind of evaluate the situation.
Exactly.
Okay, so the treatment plan is really tailored to the specific patients
Yeah.
and the type of heart attack they're having.
Right.
That makes sense.
Yep.
What about medication in general?
Hmm.
What role does that play in treating a heart attack?
So medications are a crucial part of both the immediate treatment and long-term management. In the ER, you'll probably get aspirin
Right.
to help prevent further clotting.
Okay.
And nitroglycerin is another one.
Yeah, I've heard of that.
Yeah, that helps open up blood vessels
Okay.
and improve blood flow.
So it gets things moving.
Exactly.
And I know there's lots of other medications that
Yeah.
people might get after a heart attack, like beta blockers and
Well,
statins.
yeah, those are common ones.
What do those do?
So beta blockers, think of those as like calming agents for your heart.
Okay.
They slow down your heart rate
Mm-hmm.
and reduce your blood pressure.
Okay.
And that takes some of the strain off the heart muscle.
Gotcha.
Statins, on the other hand,
Mm-hmm.
those help lower cholesterol levels,
Okay.
which can prevent more plaque from building up in the arteries.
So it's all about reducing that risk of future problems.
Exactly. It's not just fixing the immediate problem.
Right.
It's also managing those long-term risks.
That makes a lot of sense. Now, one thing that really surprised me in the article was this idea of reperfusion injury.
Oh, yeah.
It seems kind of counterintuitive that getting blood flowing again could actually cause more damage.
I know, right?
You'd think that would be a good thing.
Yeah, you would think.
But it's not always.
Not always. So it turns out that the sudden rush of oxygen back into the heart muscle
Yeah.
can trigger a bunch of things that can lead to more cell death.
Oh, wow.
It's kind of like a shock to the system.
So, like, if you were dehydrated for a long time
Yeah.
and someone suddenly forced you to chug a ton of water,
Exactly.
that wouldn't be good for you.
Not at all. Your body needs time to adjust.
Yeah, that makes sense. And that's why researchers are working on ways to minimize that.
Yeah, exactly.
Like using medication to protect the cells
Uh-huh.
or even cooling the heart during procedures
Right.
to slow things down.
Yeah. There's a lot of research going on in that area.
It's amazing how much we're still learning
I know. It's fascinating.
about the heart and how to treat it.
Definitely. Okay. So beyond medications and procedures, the article also mentions cardiac rehab
Yeah.
as an important part of recovery.
What does that involve?
So cardiac rehab is a structured program
Okay.
that helps people regain their strength
Right.
and improve their heart health after a heart attack.
Okay.
And it usually includes exercise,
Uh-huh.
education about healthy lifestyle choices, and counseling to help with the emotional and psychological stuff.
Right, because that's a big deal too.
It is a huge part of recovery.
So it's like a whole body approach.
Exactly.
Addressing all aspects.
Yeah, we want people to get back to their best selves.
Absolutely. And it seems like the prognosis for people who've had heart attacks is actually improving.
It is.
That's good to hear.
Yeah, thanks to advances in treatment and prevention, people are surviving heart attacks at much higher rates.
That's amazing.
Yeah, and they're living longer, healthier lives too.
That's good news, but I'm guessing there's still some potential complications
There are, yeah.
that people should know about.
Some can happen right after a heart attack, like arrhythmias,
Okay.
which are irregular heartbeats. And then others, like heart failure, might develop later
Right.
if the heart muscle's been weakened.
So it's important to be vigilant
Yeah,
and work with your doctor
absolutely.
to manage your health after you've recovered.
Couldn't agree more. It's a lifelong journey,
Yeah.
but with the right care and support, you can really thrive after an MI.
That's great to hear. Well, this has been so informative.
It's a complex topic.
We've covered so much.
We have from the different types of heart attacks to the treatments and everything in between.
Yeah, the causes, the symptoms, the risk factors.
Uh-huh. It's a lot to take in,
It is.
but important to understand.
Absolutely. And we're not done yet.
Not bad.
There's still more to unpack in this Wikipedia article.
Yeah. In the next part, we'll explore some of the less obvious aspects of MI,
Okay.
including how it's portrayed in media
Right.
and some of the legal issues that can come up.
That should be interesting, so stay tuned.
Yes, we'll be right back.
Welcome back to the deep dive. We've been talking all about heart attacks, and wow, it's been a lot of information.
It really has.
But we're not done yet, are we?
Not quite. We've talked about the medical side of things.
Yeah.
But heart attacks don't just happen, in a vacuum.
Right.
There's social, cultural, and even legal stuff, too.
Yeah, and the article mentions some of those broader issues, like
Yeah.
how heart attacks are often shown in movies and TV in a really dramatic way.
Oh, yeah.
And that can be misleading, right?
Totally misleading.
Because it doesn't always look like that in real life.
Right. It's not always clutching your chest and falling over.
Right, exactly.
It can be much more subtle.
Especially for women.
Yeah. Especially for women and older adults.
So it's important to remember that
Absolutely.
any unusual discomfort could be a sign of something serious.
Yeah. Even if it's not that classic heart attack pain,
Right.
it's better to be safe than sorry.
So true. And that's where public health education comes in.
Big time. We need to teach people about the different ways heart attacks can show up.
Exactly. And to encourage them to get help right away.
Yes. Early intervention is key.
Absolutely. Now, speaking of things that might not be so obvious,
Yeah.
the article also mentioned some legal implications.
Oh, right.
That was really interesting to me.
Yeah, it's something people don't always think about.
No, not at all.
Yeah.
So, for example, a heart attack could be considered a work-related injury.
Yeah, in some cases, especially if it's triggered by stress or like physical exertion on the job.
Oh, wow. So, like, if you have a really demanding job?
Exactly. And there are also legal issues around things like driving restrictions.
Oh, right, because you can't drive if it's not safe.
Exactly. In a lot of places, people who've had heart attacks have to get checked out by a doctor to make sure they're okay to drive.
It's all about safety.
It is. Yeah, making sure everyone's safe on the road.
It's crazy to think about how a heart attack can have these ripple effects.
It is. It really shows how everything's connected.
Yeah, heart health isn't just about our choices.
Right. It's also affected by social things, economic things,
Right.
even legal stuff.
Absolutely. It's a complex issue.
It really is. So,
Yeah.
is there anything else in the article that you found particularly interesting?
You know what stood out to me was the information about coronary artery spasms.
Oh, yeah. I remember reading about that.
We've talked a lot about plaque buildup,
Right.
but spasms can also block blood flow to the heart.
That's totally different, right?
Yeah, it's less common than blockage from plaque, but just as serious.
Wow.
They're like sudden, temporary tightenings of the muscles in the artery walls.
Oh, so like a cramp?
Yeah, kind of like a cramp in the artery.
Ouch. And what causes those?
So we don't know everything about what causes them,
Okay.
but some things can trigger them.
Like what?
Smoking, extreme cold, stress, even some medications or drugs.
Wow. So a lot of different things can contribute.
Yeah, it's another example of how lifestyle and environment play a role.
Definitely.
Yeah.
So the treatment for a spasm is similar to a plaque-related heart attack, right? Yeah, the first step is always to restore blood flow as quickly as possible.
Okay.
But then the long-term management is a bit different.
How so?
Often involves medications that help relax the blood vessels
Okay.
to prevent future spasms.
So preventing them is key.
Definitely.
It seems like we're always learning more about the heart.
Always. Cardiology is a field that's constantly evolving.
That's amazing.
Yeah.
So as we wrap up this deep dive, is there any final thought you want to leave our listeners with?
You know, I think the biggest takeaway for me is the power of knowledge.
Yeah.
The more we know about heart attacks, the better we can prevent them,
Absolutely.
recognize the signs, and get the right treatment.
It's about taking control of our heart health.
Exactly. Making smart choices that can literally save lives.
Well said. It's been an amazing journey.
It has been a fascinating deep dive.
And I feel a lot more informed about how to take care of my own heart.
That's great to hear.
Thank you so much for joining us on the Deep Dive.
Thanks for having me.
And to all our listeners, thanks for tuning in.